Hello guys, it's Dr. Marco here, and today we'll be discussing about foods that you should actually consume if you have diabetes. Now, right off the bat, I'd like to discuss about a diet that has changed the life for many diabetics that have tried it. It has worked really well, and the diet is Keto Diet. Now, you might have heard of the Keto Diet before as a general diet to lose weight, but it's actually a really good diet for glycemic control. So you might be thinking what the keto diet actually is. You've heard about it, you've never tried it, but you want to try it, right? And you'd be thinking, what's the keto diet about? So the keto diet is composed of 5% carbs, or 5 to 10%, that's a low proportion. The next is 20 to 25% protein, a bit greater than carbs, but not as much as the fat component. So the fat component actually constitutes for about 60 to 75% of your diet. Now, the keto diet, due to the high fat content, the mid protein content, and the low carb content, actually releases the least amount of insulin when it is given to a patient. Now, pre-diabetics, those that do not have diabetes yet, but they may develop, are in the pre-diabetic range. And I've seen patients recover completely from pre-diabetes and things like metabolic syndrome just by trying the keto diet. So you should give that a go. And the other diet is the Atkins Diet. Dr. C. Atkins was a great physician who actually discovered how he could control these symptoms and how he could help the patients lose weight by his diet. Now, his diet is a bit different, but an easier version of a keto diet. So if you want to go on a keto diet, I would say first try the Atkins diet and then move on to the keto, which is a bit more harder in the sense that it has lower carbs. So your body needs to, brace for impact, if you would think of it like that. And the Atkins diet has about 10 to 20% of carbs, about 25 to 30% of protein, and the rest, about 55 to 60%, is fat. So it has a lower fat content than the keto, a higher protein content than the keto, and a bit higher carb content. So it would give you, a nice practice match before you go on into the ring, right? And now let's move on to the foods that you should eat if you have diabetes. Now, the first thing I would like to say is raw vegetables. Raw vegetables are a powerful tool for diabetics. If you eat raw vegetables, you are actually consuming a lot of fiber, and the fiber is actually helping you absorb that glucose from the gut at a much slower rate than if you would not have fiber in your diet. Those spikes in the blood sugar actually lead to spikes in the insulin levels, and those spikes are not good. They can give you symptoms like a throbbing headache, or feeling like you're not full and you have to eat again, or feeling like you have to urinate much often than you used to before you had diabetes, right? Yeah, and by the way, potatoes and corn, they do not count as vegetables. They count as carbs. And because they have such a high carb content, they are not considered as vegetables for the diabetics. So the next thing is fruits. So fruits are really good, nutritious thing, but you have to stay clear of one thing: no applesauce adding, no adding of that juice in the fruit salad. That's bad. And there are certain fruits that are really high in sugar content, like mangoes and bananas. So what you should do is you should opt for the less ripe version of mangoes. For example, if you are eating a mango that's really ripe, it has a really high sugar content, And if you are eating a mango that is not as ripe, it's a bit green, you would have that same flavor or a bit less flavor, but a lot less sugar. Now, other fruits like guava, they also have a lot of sugar. You should avoid guavas. You should avoid dates. Dates, they do have a lot of fiber, but they do have a lot of sugar. Now, talking about sugar, grapes have a lot of them. Raisins and dried grapes, they have a lot of those. So you should avoid these high sugary and fruits. Opt for the less ripe fruits, and something in between would do good unless you're having half a serving. So moving on to the third thing is protein. Now protein is your friend, and that's because you're giving up on carbs. Team carbs has let you down. You've bet so much on team carbs that now you started to hate it, right? And now you have to move on to protein. Now protein is your friend because it gives you that feeling of satiety, that feeling of fullness. The thing is that protein takes a lot of time to digest, more time than carbs do. And by just sitting there, it gives you that feeling of satiety, releases more of those satiety hormones. And so eat more protein. In a meal, if you eat about 50 to 75 grams of protein, you'll be feeling more full. So instead of eating cereal for breakfast, you'd be better off eating eggs for breakfast, because eggs have both the good fat and the good protein. You would be feeling a lot better than if you would eat cereal that's high in sugar, high in carbs, refined ones, low nutrients. In diabetes, a lot of patients, they actually see a decrease in muscle mass. So eating that protein would help you release that growth hormone, because in diabetes you have high blood sugar levels, and high blood sugar levels suppress the release of growth hormone. Growth hormone is necessary for maintaining your bone mass, for maintaining your muscle mass, and for general repair and building of your body. So if you're eating more protein, you're keeping those glucose levels under control. So your growth hormone is now starting to kick up a bit. It's conserving your muscle mass, conserving your bone mass. It's keeping you strong. So the next thing is dairy. Now in dairy, I always recommend yogurts, but not those yogurts you're thinking about. Those yogurts that are blue or pink or red in color, beautifully aligned in that grocery store in a line, and just giving that fruity smell. No, those yogurts are bad. You cannot have them. What you can actually have is Greek yogurt that's high in protein, has a good amount of fat, and it will keep you full. And regular yogurt will do, because it is low in glycemic index. Now talking of glycemic index, you should have low glycemic index foods. Now foods higher on the spectrum are generally also higher in carbs and higher in sugars. For example, sugar has a glycemic index of 100, and a cucumber would have a glycemic index of about 10 to a 20. So it's a low glycemic index food. Sugar, on the other hand, is a high glycemic index. What you're looking is somewhere in the middle, but mostly in the low glycemic side. So vegetables make up the low glycemic, fruits are somewhere in the middle, and cereals, potatoes, baked products, sugars, sugary drinks, they are the higher end. So this end is not safe. This is good enough. So yeah, one more thing. If you like fruits and you want to eat a lot of them, but you cannot have a lot of them, right? Because of the sugar content. But guess what? Berries like strawberries, blueberries, Indian blackberries, they have, or goji berries, they have a lot less sugar content than typically those other fruits have. They also have a lot less calories, and they have good amount of fiber. So you should try berries. You can freeze them. You can put them on a yogurt bowl, and you can just make a smoothie out of them without the sugar added. So berries are good. And nuts, you can have nuts. But nuts are generally high in oxalates, and they're prone to making kidney stones. But you can have less amounts of nuts, like walnuts. You can soak them through the night, and then by the morning they would have released their colorings, those plant colorings they have in their shells. They would have released them, and they would be a lot less lighter in color. So you can eat them in the morning with your eggs or with your protein that you would eat. And speaking of protein, you should have white meat. Fish is really good because it has omega-3s. Fish like fatty fish, like salmon, like mackerel. These fish are really good. Stay away from tuna. Tuna has high mercury levels, so it's not good. At the end, I would like to say is, start exercising if you're not. Because if you exercise, you will have a lot easier time managing your diabetes than if you don't. Now, the CDC recommends about 150 minutes of exercise per week, and the World Health Organization recommends about 90 minutes of strenuous exercise per week. If you work out 30 minutes a day, about 5 times a week, you would have 150 minutes of exercise per week. Now, if you exercise, your insulin resistance will actually lower. You will have to lower your meds. And if you also go on a keto diet with addition to exercise, well, you would really have a hold of that diabetes by the roots. If you like this video, make sure you give it a thumbs up. If you have any queries, leave down it in the comments. I actually do read my comments and I like to answer them. And if you think that this video was helpful at all, or it would help someone, send them the video, share it with them, and subscribe, press the bell icon so that you are notified when the next video comes out. Thank you so much. By the way, I also have another video on the topic that what foods you should avoid if you have diabetes. The link would be in the description, so go check it out.